One thing I would say here is that insurance premiums have risen over the last few years in line with the rising cost of veterinary care. Now, I firmly believe that every pet should have access to affordable veterinary care, but I think there is also something really important here about considering different treatment options in any situation and being very clear with your vet about your budgets and making sure that you have those really open conversations with your vets about what you can afford, what you're willing to put your dog through, what you're not willing to put them through, and making sure those conversations are had up front.
Welcome to the Consult Room, the podcast where we explore the evolving world of modern pet care. I'm Dr Paul Manktelow, a UK veterinary surgeon with a deep passion for pet health and welfare. In each episode, I'll be exploring key issues, challenging perspectives, and offering expert insight and practical advice. Because ultimately, my mission is to improve the lives of pets and the people who love them.
In today's episode, we're going to do something a little bit different. Now, every year at Crufts, we have a feature where people send in their questions. And also on my social media accounts, we regularly get people sending in pet health questions. So what we thought we'd do today is dedicate an entire episode to you, our listeners, to answer all these questions. Now, lots of you got in touch. We put a shout out a couple of days ago. So we've got a stack of questions to get through. I'm not going to do this alone. I'm joined by my producer, Annie Clark. So Annie's also a veterinary nurse, so she knows firsthand just how many questions people have when it comes to their pets. So she's going to help me a little bit reading out the questions from the various social media platforms, but also help me with the answers as well. But before we dive in, I just want a quick note that what we're sharing today is general advice only. It's not a substitute for speaking to your vet because, of course, we can't examine your pet. And these are also very short questions with not a lot of history in the background. But hopefully we can give you some useful insights and point you in the right direction. So Annie, welcome to the show again. Quite a regular on the Consult Room, aren't you?
Yes, so it would seem. Glad to be back. Let's get started with the first question, shall we? Should we dive in?
Let's go for it.
Okay, so the first question we've got is from Loveday Kirsty, who sent a message in to Instagram. She DM'd you. And it's about her dog obsessively licking his paws or her paws. She hasn't actually said. Doesn't seem to be allergy related. Can dogs get a version of athlete's foot? And if so, can you use any at-home remedies like Canesten cream or anything else antifungal?
Okay, so licking of paws is actually really, really common in dogs. It is, I would say, one of the classic signs of atopy. That's the most common cause. I think in the question, the sender has said it's not allergy related. So I'm not sure whether they've done some investigations of this, but in my experience, atopy which is, sort of a skin allergy reaction, can manifest in all sorts of different ways, but it's really difficult to assign the allergen. And I know Rodney does it himself. I think it's seasonal related in him because it's more frequent sort of in the spring, summer months when the pollen counts are high. But it can be a number of other things like food, contact allergens for things that your dog's paws comes into contact with, salt on the roads in winter, grit, all those sort of things. But it sounds like we've ruled allergy out, which I think is quite bold because obviously it does envelop a lot of things. So I think it's interesting, this word of obsessive here, isn't it? Because immediately I thought of a behavioural sort of compulsive type behaviour, which can be due to an underlying cause. For example, pain, joint disease, you can get sort of little microforeign bodies in the skin, can't you? But you can sort of get behavioural compulsive behaviours as well, can't you?
Guess it's like breaking the cycle, isn't it, in those situations? If it is a behavioural problem as opposed to an actual medical one.
I've seen this in stress-related behaviours when dogs have a change in circumstances, house moves, there's something within the home or within the environment that's causing them stress, and it manifests itself in that sort of licking behaviour. Now, dogs do lick generally, don't they, as a sort of a calming mechanism. Licking and chewing is quite normal. What are those short-term things that you talked about breaking the cycle?
I think it's putting a barrier to stopping that, the ability to keep doing it, isn't it? So it's like finding something like a booty, maybe if it's paws specifically, or finding some way. I mean, a cone of shame seems a bit a bit harsh in this situation, but in all honesty, might be the thing that's needed if this is a behaviour or compulsive problem.
Yeah, I think breaking the cycle is not actually addressing the underlying cause, is it? But having said that, when dogs are doing something like excessively scratching or licking, they are actually causing trauma to the skin, and that can actually create that cycle. So if you imagine scratching at something or licking at something excessively, what you're actually doing is creating a compromise to the integrity of that skin. You're causing skin damage, which in itself can be painful or itchy, which then causes to more licking, and you keep going through that cycle. So the whole principle of those little booties or the cone of shame, like you say, is actually to break that cycle, allow the skin a bit of time to repair itself, and heal and stop being an irritant, which then directs that attention. However, like I said, it doesn't treat that underlying cause. So if there's a stressor or something there. But can we go on to the actual main substance of the question, which is, can dogs get athlete's foot? And can you use home remedies or anything else antifungal like Canesten cream? Now, dogs don't get what we consider athlete's foot. That's our classical fungus that causes it in humans. We don't get that. But they do get fungal problems on their paws. So ringworm is one of them. Dermatitis from ringworm. They can
Contagious
get,
as well, isn't it?
yeah, that is absolutely. Or a yeast infection called malassezia can be present in the skin, all over the skin really, but you can get it in there. But I think these things need to be diagnosed rather than just treatment. And I would be slightly concerned about just putting topical creams on the paw, because the dogs can lick them off. And they are not meant to be ingested. Now, ringworm, like you say, is contagious to people, but you can diagnose that. Your vet can diagnose that with a wood lamp, or even a culture. You can actually grow it from affected sort of hair plucks and things like that. But I would sort of, avoid using those topical creams unless you've actually got a diagnosis. Would you agree?
Yeah, I think so. It's a difficult one to answer. I mean, ultimately, as you say, there isn't a doggy version of athlete's foot, but there are a host of other issues that they could have. And without actually looking at it, I think this is one of those ones where I think that the list is too long. And it's a process of exclusion, isn't it?
Yeah, I would say atopy first. That's really the most common. Behavioral or stress type signs is second. And I think sort of for me, those fungal things are probably quite low down on the list. Not to say they're not there, but I would probably move to a diagnosis through your vet before you use any of those topical creams.
Agreed. Next one is a little bit of a sad one. Suzanne Bannon messaged you through Instagram when we put the stories out to get the questions in. How do you support cats through grief? Our little one lost his best friend / partner of 15 years. Firstly, I just wanted to say I'm really sorry, Suzanne. That's really sad. This is something that we deal with a lot, isn't it, within our other sort of business with Home Goodbye, isn't it, Paul? So over to you.
Well, yeah, I get asked this a lot actually, not just around sort of cats, but also dogs when they lose a member of the house through grief. It's not always the other pet, is it? Sometimes it's a family member as well. So I guess the first question, I guess, is, do pets experience grief? Annie, you're a real expert on this.
So yes, I think pets or companion animals, when they go through a loss of another companion animal, definitely do show signs of grief. There was a really lovely book that I read a while back, actually, and I've recommended to people before, that has some really interesting information about, more specifically, dogs and how they grieve, and show signs very similar to humans. And it's by Barbara King. It's called How Do Pets Grieve, which is quite an easy title to remember. And dogs are, I guess, maybe there's something in the way that we've humanized and domesticated dogs that mean that they have sort of the ability or the emotional processes that we as humans have when we grieve. Cats are slightly different. We haven't domesticated cats in the way that we think we have. They are generally much more solitary animals, but they do bond with other companion animals, other dogs in the home, other cats in the home, and they can show signs of grief. And that can be anything from withdrawing from other members of the family, reduced appetite, searching, calling, sleeping in the same area is another one as well. Where the companion animal that's passed away, tend to find that, they'll kind of start sleeping in there all of a sudden where they've never been before. Funny enough, happened to me when I lost my cat many years ago. One of the other cats in the household decided he was just going to adopt all of the routines of my old cat, and it was a bit of a surprise. I didn't expect that to happen. But like with anything, if cats start showing any of these signs, like reduced appetite or clinginess or withdrawal, I think it is really important that you just rule out anything medical to start with. Grief can be a disguise for medical illness. So I think that's definitely something to consider.
Yeah, I think it was important what you said there about that routine, isn't it? So my experience of this when I speak to people that have lost a pet is that animals sort of thrive on a routine, don't they? And
Yeah.
you often have lots of routines in the house that involve interaction with people and other pets. And actually, if a person or a pet sort of leaves that routine, it does leave a
Yeah.
strange dynamic, and that can displace animals quite a lot. And from speaking to a lot of people that have been through this, that when their own routine is also disrupted, for example, they
Mhm.
may have lost a cat or a dog, it does throw the household out of whack a little bit, doesn't it? And also, pets do feel our emotions, don't they? And when you lose a pet,
Certainly do.
obviously there is the process of grieving that you're going through yourself, and how you interact with your pet that's remaining may be changing slightly because of how you're feeling emotionally. So I think it's like for this, it's recognizing those signs of displaced behavior, but also putting in some really sort of positive steps to create the new routine in the new normal and getting things back into a rhythm is really important, isn't it?
Yeah, and I think there's that whole thing as well about not rushing to go and get another pet, especially with cats. I think you need to allow them time for their personalities to adjust, and to almost find their new normal within the new dynamic. Especially with when it comes to sort of the cat hierarchies, if you like, in multi-cat households. So something to consider. Um, again, it was all very much dependent on the personality, but I do tend to say don't rush by getting a new friend for them. Let them have some time to get used to things, and also don't forget, they cats, they whilst they might be quite aloof sometimes, they do appreciate that extra interaction, and giving that extra attention isn't going to do them any harm. It's a bit different with dogs, which we don't want to divert too much from the question, but with dogs, yes, never say to an owner not to lavish their remaining dog with attention, but you do have to be careful that you then don't start to create a bit of a problem when it comes to behaviour. They become more clingy and all that sort of thing.
We do sometimes overhumanize our pets, don't we? So we understand that we feel significant grief and a sense of loss, and we expect our pets to also feel that. And it's not always the case. Like I know, of cats, for example, where the other cat has passed, and they cope really well. And I hate to say it, sometimes they like the dynamic of being the only cat in the house,
Absolutely.
and it's actually can be similar for dogs as well.
Mm.
Like, I think of my dad's dogs, and they've lived together all their life, but I honestly don't, I don't think one of them would. I think one of them's quite needy,
Yeah.
and needs the attention of everybody in the house. The other one's quite aloof, and I think would cope quite well with the passing of
Yeah.
the other dog. So I think it's important that we treat this objectively and react to our pets, what they're telling us, what
Yeah.
they're showing us. And if they seem to be coping fine and they seem to be eating, drinking, going through their normal routines fine, then they probably are fine. And we shouldn't want to impress grief on them,
No.
and expect them to feel sadness that they don't. And yeah, and just trying to be a bit more objective about it. Would you agree?
Absolutely. And if you know, Suzanne, your cat is showing signs of grief, I think just go back to that. Make sure you know that they aren't unwell. Have a chat with your vet, and if not, then kind of, as we've said, stick to those routines, those predictable routines. Let them find time to adjust to that new dynamic, and hopefully with a bit of time they will be okay.
And just like people, who cope with grief in all sorts of different ways, pets can too. So I think looking for some of those classic signs of displacement would be really helpful here.
Definitely. Okay, so we are moving on to our next question now. Forgive me, I don't know your name. I only know you by your handle. So this is JRJBCN who sent a message through Instagram. I'm frankly terrified of cutting my dog's nails because I've seen it go wrong, and I don't want to traumatize either of us. As a vet, have you ever had any mishaps when cutting nails? And is there any particular product you recommend that minimizes the risk of accidents? Good old nail question.
Yeah, so I think the opening line of this is "I'm frankly terrified" is an interesting one, and it points to me that you really need to have confidence in doing this at home, um, and your pet needs to have confidence as well. Now we're talking dogs here, but sometimes people do want to clip cats' nails as well, particularly sort of indoor cats. Um, but I think it's really important, first of all, the most important foundations for this are get your dog used to handling their paws. Because the last thing you want is a dog who feels frightened of what you're doing, you coming at them with a pair of clippers, and obviously they're moving, you're trying to hit a moving target. None of that is going to be good, both in terms of what you're trying to achieve, which is clipping a nail, and the experience for both you and your dog. So I would build up to this from a very early age, literally holding their paws, squeezing their nails, getting used to sort of separating the toes out, moving towards it with some clippers, not actually doing anything for a long time, just so you can actually get them used to it, and then rewarding them with that. If they're sitting calmly, rewarding them with the treats and lots of praise. Often this is a two-man job, and if you want to, have somebody hold, it's better to have them quite close into you and holding their paw out so you can squeeze it. The other person just manipulating the clippers. Like for Rodney, he's used to it from a puppy. I've done all this and I can manage it on my own, but for some dogs it's really, really tricky, and what you don't want is having them struggle quite a lot. In terms of the question, can you recommend in particular products? Really good, sharp, strong clippers are really important. You want to do that in one sort of go, but they need to be appropriate for the size of your dog. Now, for very, very small dogs and cats, I think sometimes human nail clippers are just as good, as long as you can maneuver them. But as your dog gets bigger, the size of the clippers need to be bigger because obviously there's a certain toughness there. Now, some people where the dogs don't like clipping have there's quite a few of these sort of grinders on the market.
Yeah.
Now, for me, again, they're noisy and you need to get your dog used to the sensation of them. It's the same principles of clipping, but I think what they do is there's always this concern, isn't there, of clipping nails too short and ending up in a bit of a bloodbath, which is something we try and avoid in veterinary medicine. Now, if your dog's claws are pale in colour, you can actually see where the blood vessel ends, so you know where that is. But for a lot of dogs, they have dark nails and black nails like Rodney, and it's very, very difficult. Now, for some of them, you can actually use your phone light, the torch on your phone, and you can actually see through the nails and you can actually see where that blood vessel is. It's not always possible. I know I can't do that in Rodney. It's got very, very thick black nails. But in those, sometimes I use the nail position when the foot is in a standing position to see whether that nail's too long. They should be sort of flush. The toes should be flush with the floor. If you look like the toes are raised slightly, it could be that claw is too long. But Annie, you're probably more of an expert on nail clipping than me. So do you have anything else to add?
I've avoided nurse clinic for years, Paul, so I'm sure I'm an expert. I mean, I think all I would say from a reassurance standpoint is, even with the best will in the world, after many years of being a veterinary nurse, there is a chance that you might catch the quick. And it's not ideal, and especially as you are obviously terrified of the idea of doing that. But if you do it, I just want to reiterate, stay calm, because they will feed off you. If you start to panic, they will probably start to panic, which will raise their blood pressure, which will result in a bigger bloodbath. And there are some things that you can use to help stop that bleeding quite quickly. It's a bit like a paper cut in the sense that it bleeds a lot for a very small vessel. So what you can do from an immediate sort of, if you're a home baker, you should have some cornstarch at home. So it's a good one. Or some just flour actually is a really good anticoagulant. So get a bowl of cornstarch, get a bowl of flour, pop the paw in there. Keep them calm is really important. And ideally, if they're not going to stay still, which I appreciate is not always the case, then a tea towel rinsed under a cold tap and then wrapped around the paw, a pressure applied for a good 10 minutes. As I say, they are very good at bleeding, so they do take a bit of time to stop. But that cold tea towel, that cold water will help to constrict the blood vessel and hopefully stop that sooner. It happens to the best of us. So whilst that's not a good tip to stop doing it, I think it's important to address, if it does happen, what you should do. And if you have a dog that is in really highly strung and gets really stressed, even with lots of sort of handling, as Paul said, of the feet and getting them used to that, if they're just not amenable, have a chat with your vet, because there are some medications that can be given to help take that anxiety level down. Or you can start building their confidence with some fear-free appointments in the clinic if you think doing it at home is just not going to work for you.
Yeah, I think those appointments are important to not do anything initially, aren't they? Just go to a situation. It's the same principle, isn't it, of managing or handling paws at home. But yeah, I mean, also I've had situations, I've been a vet for over 20 years. So obviously there have been some incidents. And I think the thing is about bleeding claws is that they do take a while to stop bleeding, mainly because the animal's putting weight and pressure on that. So the blood flow to that area is particularly pronounced, isn't it? And but they do stop. And I think even if there is a bit of bleeding, it's not the end of the world, is it? They do heal eventually. It just can look quite dramatic, I think, sometimes, can't
No,
it?
and I think the pain element actually comes from the pressure from clipping the nail and catching the quick, not the actual bleeding action.
Mm-hmm.
So the pain is actually quite short-lived in most instances. It's just the bleeding looks, as I said, it looked quite dramatic.
Yeah.
Okay, so next up we have Cheryl, who sent a DM through TikTok. And she has said, our Chihuahua has always had really watery eyes and a lot of tear staining on his face. Well, this sounds familiar to me because I've got one of those. Is there anything we can do to help reduce it?
So this isn't a new thing where you're suddenly getting watery discharge from the eyes. This is something where you are getting overflow of the tears. Now, this can be anatomical, and you often see it in Chihuahuas. They can have quite large sort of bulbous eyes, shallow eye sockets. You often see it in brachycephalics as well. There's quite a few breeds that you can see, but you often see it. I mean, it's very prominent in dogs that have got white fur. So you see it, in your Bichon Frise and your pale and your tan Chihuahuas, and it looks like dark fur staining round the eyes. Now, it's important to have that as a baseline, as is it normal, first of all. So there isn't anything that, apart from the anatomical structure of that particular dog, that's preventing it. So, for example, tear duct blockage, and there's a little test that vets can do where they put the fluorescein dye, you can put a drop of that in each eye. It's what makes the eyes go green. And you can see that coming out from the nasolacrimal duct around the nose. So you should be able to see that coming down through the nose. Now, if there is no dye that comes down there, then it could be indication that tear duct is blocked, and that might be something you might want to explore to see whether they need flushing or anything like that. So, but is the tears, are they flowing naturally out there, and is this just overflow? Now, there are irritations to the cornea and to the eye that can cause excessive tear production. So that's the other thing that you might want to just consider. And some dogs have, hair touching the eye. They may have what's called entropion, where the eyelids are folded in. Again, there's a lot of breed specific, dogs that could have that problem. But I think if it's a sort of a normal problem for that dog. There isn't a huge amount, I would say, that you can do apart from keeping the hair around the area nice and short, nice and trim. If you are getting a buildup of discharge, give the eyes a bit of a wipe. But as long as there's no redness of the
Yeah.
eyes or any pain present, I have seen over the years on the market lots of these products that you can add to the food and claim to sort of reduce that tear staining. And I've heard a couple of products are very, very effective. But I am a little bit wary of them because I don't think many of them are veterinary approved. And you just got to make sure of the ingredients of them and make sure that you're not giving your dog something that is bad. But that's not to say that they might not be effective. But I don't have a lot of experience in those sort of products, I'm afraid. Annie, do you have anything to add?
No, I mean, I think, as you say, is making sure that it's nothing abnormal. But Chihuahuas are. I've never met a Chihuahua that doesn't have excess tears, if I'm honest. Especially the apple domed Chihuahuas. So with my Chihuahua, I think the only thing that it's not so much about a case of reducing the amount of tear stains he has, but I think it's just, I think you mentioned it before, a bit of like daily gentle hygiene. He's really good at letting me just get a little cotton pad with a bit of sort of cool boiled water, sterile water, and just wiping away that excess, especially in the mornings. It seems to be worse for him after being asleep. So just wiping that away and doing that daily, but nothing else that you haven't already mentioned, Paul. Right, so next we've got Ryan. Ryan's got a bit of a sad situation going on. So his dog has been diagnosed with an aggressive type of cancer. We have decided not to go down the chemo route, and for now he's managing well on pain medication and steroids. We don't want him to suffer, but also want to enjoy what time we have left. What should we be looking out for, and what are the signs it is time to put him to sleep?
Hi, Ryan. Well, first of all, my thoughts are with you. This is an incredibly difficult situation, and it's the one that causes most of us torture if your pet gets a sort of a debilitating or a terminal condition. And I think there's quite a lot of research on this now, isn't there, about the concept of anticipatory grief, where you know that they're reaching the end of their life and you start grieving before that, and it just becomes very, very difficult and quite emotional situation. But I think, well, my advice here would be to try and bring it back to some really objective frameworks on how to assess quality of life. In very simplistic terms, I look at sort of three main things. Mobility is one of them. Your pet's behaviour, are they exhibiting normal behaviours, and appetite. Now that's a very simplistic one, and Anna, you probably know some more sort of involved tools which you can talk about in a minute. But I generally ask people to look at those things regularly. Is my pet eating? Can they still eat? Are they able still to move around and do the things that we know they like exploring and, sniffing the garden or going for a walk? And are they still engaged and interacting with us normally? Do they still want to, engage with us and come up to us for, cuddles, or they're becoming quite withdrawn, or do they seem more sort of lethargic or depressed? Now, these are all things that are quite simple to look on a daily basis. And keeping track of them. I mean, obviously, with any terminal condition, your pet's going to have good days and bad days. And I look at those again objectively. Are the good days still outnumbering the bad days, or do they seem to be deteriorating? But one sort of real sort of key bit of advice I would give in this situation is don't make their last day their worst day. We struggle with the decision to let them go, and that's completely normal. It does become torturous in an animal that has a chronic condition. I know, just going back to my previous dog Dolly, who had a spinal cord tumor, that was pure torture. Good days where she could get up and walk around with a bit of impaired mobility, bad days where she was struggling to stand up at all and becoming quite distressed, but then the next day she'd be fine again. And again, it's you get yourself into this real cycle of when is the right time to let them go. And I just don't think there is ever going to be a right time to let them go. It's very, very difficult to be able to contemplate that, because our pets are family members. and we don't have to make those sort of decisions for our human family. But there are certain things you can look for. Annie, I'll hand over to you for any other frameworks that you use.
So just going back to the anticipatory grief thing, I do feel, and I do say to people that, explaining that whole process that you're beginning grief before you've even lost your pet, it can cloud your judgment a little bit. And so I do say to people, that you might struggle to be objective in that situation. There are a few things that you can do, especially if you've got a long timeline from the point of diagnosis to the point of loss. Keeping a journal, making a daily diary, tracking what each day looks like, because it can be very hard to remember from one day to the next what's going on. And that's a good way of evaluating how many good days versus bad days they're having. But also speak to family and friends who might not necessarily live with you, who might not see your dog all the time. They will give you really valuable insight as to how your dog might be doing, because part of the grieving process is denial. We all know that it's with human loss, with pet loss, denial is there. You might not think you're in denial, but actually it happens to all of us at some stage. So therefore it's really important to get those kind of opinions, outside opinions, on how things are looking, just to help sort of formulate your decision. Because whilst we can look at the really, as you say, the physical things like the mobility, the appetite, the engagement, all of those things, there is a bigger picture. It's not just looking at those things individually.
Yeah, and I think objective frameworks are really going to help in emotional situations, aren't they? And I do think, even though it's really, really tough, I think that the conversation about euthanasia needs to be had quite early on. And by that, I mean considering your sort of parameters for when the time will be right. So you set that out quite early on. And for me, with Dolly, it was, if she goes off of food, because she was really food orientated, if she's unable to go out for a walk, those were the sort of things that I said, actually, that's the time at which I'm going to let her go. Because for me, that was where she got most of her joy. So it would be sort of, it's clear to me that if she was unable to do those things, that actually the joy from her life will go pretty quickly. And then I'd end up with a dog who would, be shut down mentally, who would start getting quite depressed or even distressed about not being able to do what she wanted to do. So I set those parameters quite early, and I found that quite helpful, because it's interesting. We go through this as, we can be very objective when we're vets and nurses, can't we? But when we're actually going through it ourselves, it's we are in the position of a pet guardian straight away, aren't we? With all the associated sort of emotion of that. So I found that really helped me set out those objective parameters right at the start, and then sort of stick to them almost, because like you say, sometimes getting a family member in is almost that fresh pair of eyes, isn't it? Or a friend that's visiting, because when you're in it every day, you don't really notice those incremental changes, those tiny little changes or deteriorations that affect your ability to look at the big picture. But yeah, really difficult situation.
No, and I just want to say as well that I think it's really good that he's asking the question now. It's a great way of mentally preparing yourself for what's coming. It's not easy, but absolutely great that you're asking the question, although a very difficult one. And I don't think, never underestimate the ability to give your pet a good death. And planning ahead as well. It's very hard to do that, and we never know 100% one day to the next. Things can change rapidly, as we know, but also having all of the information there and all of the tools ready if and when you need them, so you can make the decision at the right time, what feels like it's the right time, but also give them the kind of passing that you would hope for them as well.
It's one of the last kindnesses we can do for them, isn't it?
Yeah, absolutely.
Any particular specific signs of pain that you might want to look out for? Because that's one of the most common questions, isn't it? Are they in pain?
Yeah, and again, pain is animals inherently mask pain. So I think if you're ever at a point where you're concerned they might be in pain, there is a real potential that they probably are. And again, it comes to looking at those kind of real clear cut factors. Are they a dog or a cat that's really food motivated and they're not wanting to eat, or maybe they can't eat, they're trying to eat? they're going to the food bowl, but they're not actually then eating, or they're just kind of dismissing it. Or the same with going for a walk. Are they really keen to go, but they just can't manage it, or not wanting to even try? Engagement is a really, really good one, because it's something we don't always notice. Especially with older pets, you find that they start to sleep a lot more anyway. So it's very easy to be like, oh, they're just tired, they're old, they sleep a lot. But if you're finding that sleeping a lot means that they're withdrawing engagement from you more regularly, that it could be a sign that they are in pain. It might be a very quiet, subtle sign, but it is equally a sign that they are uncomfortable, and just not wanting to get up and move around and be with you is something to really take notice of.
Yeah. So Ryan, keep talking about this. It's really important. And yeah, good luck. Good luck with everything. Who's next?
Okay, so we have Claire, who reached out again on the good old Instagram stories. Our dog's almost 12, and every year the insurance has just got more and more expensive. We have only had to claim twice in the years we have had him, once for a wound and the second time when he had a bout of pancreatitis. Is it worth keeping his insurance going? It's becoming really unaffordable, but I worry in case he has an emergency. This is a really good question, isn't it? Especially with current climate.
Very good question and very relevant, I would say. So before I answer that question specifically for Claire, I probably should give in some insight into what you can expect in terms of veterinary costs for the age of your pet. Now, we know that generally when pets are young, that they don't require as much veterinary care as when they're older. And actually, when you track the cost of veterinary care from the pet's age of 1 to 7, it sort of goes up in a linear fashion like that. Okay, so for every year, for whatever reason, they may have minor ailments, lumps, bumps, whatever. The cost of their veterinary care goes up linear, but as soon as they hit 7, it goes up, like the gradient of the graph sort of goes upwards like that. So we know that and obviously there's variations in this. There'll be people listening to this that have got 12-year-old dogs that have never been to the vets outside of their annual health checks or whatever, and there'll be people that might have 2 or 3-year-olds that have been backwards and forwards to the vet. But generally, in a baseline healthy animal, that's the normal pattern. So, and because we know year on year the cost of veterinary care continues to go up, I would say that from the age of 7 to the age of 12, with Claire's dog, those costs are going to increase. So this is a really tricky one, because we know that if it followed the trajectory, and remember these insurance companies have got all sorts of data. So if they're putting your premiums up, it's because they know that you're more likely to be needing a claim. Whether or not you can afford that premium is another question that we'll come to. But if you are going to consider not having pet insurance, my advice to you would be don't have it from the start and put money aside. Now, for example, I've had pet insurance for Rodney. He's 4 now, never claimed it, never had any problems. So in theory, if I didn't want to have insurance for him, I probably shouldn't have paid it from a pup. I probably should have put that money aside. And his insurance is going up by nearly 20% next year. So again, this is a decision I can make every year. He's still quite young. He's still quite healthy. Should I use that money and put it aside? I would struggle. Like, obviously I can't give advice on whether an individual should insure their pet. That's not within my remit as a veterinary surgeon. What I'm talking about is how vet care costs increase over time. But I would say to Claire, we know that your veterinary care costs are probably going to increase as your pet ages. So do you really want to leave yourself without that insurance? Or realistically, are you able to save money? The thing about pet insurance or health insurance generally, and this goes for humans as well, is that these insurance companies have got so much data which they use to establish your insurance rates and the fees that you pay. They're businesses. They're going to make money. That's how they work. But within that, there'll be some people that are winners because their pet gets a condition that's covered by insurance, and there are some people that loses their pet's healthy all its life. But it's that reassurance piece that people really like about that. So it's a really tricky one. switching policies is again something you can shop about and get the best deal. But again, a lot of them will exclude pre-existing conditions in that. So it's a really tricky one. I think with insurance, you've either got to be in it for the lifetime of the pet. That's personally what I would do, or you've got to save elsewhere and make sure you've got that provision. Some vets now will do payment plans, some don't. You might want to consider whether, if your pet gets ill, whether a short-term loan could help. I really don't like the thought of people getting into debt for the pet's healthcare, but it's a really important question. A lot of people did cancel insurance or have cancelled insurance over the last couple of years due to rising premiums. But it's a really tricky one.
It is. I think, like you say, it just very much depends on your financial situation as well. You know, we all know what vet fees can look like. Just a bit of a background in terms of, you know, working in emergency medicine. Out of hours fees are never going to go down. And, you know, God forbid if your dog was to go in, had another bout of pancreatitis, for example, and was hospitalised for a few days, that's immediately a few thousand in most veterinary clinics. I feel comfortable saying that. So again, if that's something that you can afford out of pocket, in the off chance that does happen, it's a risk, isn't it? And you've got to make that risk assessment. I personally would be just exercise real caution, because at the age of 12, if you decide to cancel it now and then decide in 6 months' time that you want to get a new policy, you will find it even more expensive.
Yeah.
Based on the age more than anything of your dog. I don't know what breed
Mm.
you have, but if you have a
Mm.
pedigree, then it's going to be, you know, more again.
Yeah, it's impossible to say, isn't it? But I think he's only ever had pancreatitis once in 12 years, which doesn't feel like it's the likelihood is that it's recurrent. But then as they get older, they can. Don't know how long ago he had it. It could have been something, unique of the situation at the time that triggered that pancreatitis. But again, it's a really tricky one to call. We can't give specific advice on insurance. We can only talk about it in the context of your personal circumstances. But
Yeah.
knowing how veterinary care, disease conditions, and insurance companies work, it's a really tricky one, isn't it?
Yeah, absolutely. And I think it's always better to be prepared for the worst, isn't it, really? It's a good motto for life.
One thing I would say here is that insurance premiums have risen over the last few years in line with the rising cost of veterinary care. Now, I firmly believe that every pet should have access to affordable veterinary care, but I think there is also something really important here about considering different treatment options in any situation and being very clear with your vet about your budgets, and making sure that you have those really open conversations with your vets about what you can afford, what you're willing to put your dog through, what you're not willing to put them through, and making sure those conversations are had up front. We all kind of want the same for our pets, vets and pet guardians similarly, that they all want the best outcomes, but you've got to do that in the context of what is affordable and what's achievable, and I think those will help guide decisions as well.
Definitely very good advice. Right, next up. We've just had another one come in from JRJBCN. He's obviously on it today. He's asked another question. My puppy. So now we know he has a puppy. He's been worried about his puppy's nails. My puppy is 10 months old and has not yet had her first period, also known as a season. Other owners have told me theirs had them at 6, 7, or 8 months. Is she a late developer, or is this normal?
So, first season doesn't come as we always expect it. There's quite a wide variation. We typically start asking pet guardians to look out around the 6-month mark, because that's often where they can come. That's often the starting point. But, it can take up to 24 months. So it can be 2 years till they have their first season. It's thought that small breeds are sometimes earlier than the larger breeds. So it'd be helpful to know what size breed we're talking about here. But also it's important to know that some bitches do have what are called silent heats, where the signs are much more subtle, and they may not be as apparent. And ultimately you're looking at swelling around the vulva. You see sort of blood spots, discharges from there. But sometimes you don't always see that in first season, and you might notice some more of the sort of subtle hormonal signs or things like that. Now, what I would say, if you still haven't seen a season in the first sort of 2 years of that animal's life, I will probably speak to your vet. 2 years is a very long time, I would say. So, but also if you notice anything unusual, particularly any vulval discharge, any sort of systemic or whole body illness, or any signs of hormonal problems. But I wouldn't be too worried at 10 months having not seen one. You may have missed one, but you never know.
Yeah, nothing to add on that. I think you covered everything there. Yeah. Okay, so next up we have Hungry Seahorse is the handle here. And she has said, I am thinking of getting a dog, which will make me a first-time dog parent, or guardian, as we like to call it on the consult room. I work from home, so they would not be left alone for long periods, but I'm really worried about not giving them enough attention or inadvertently causing separation anxiety when I do need to leave them. Any tips?
Well, welcome to having a dog. They are, they bring so much joy to our lives, but it's right to be thinking about these things in advance. Great that you're working from home, I would say. It means that, your dog isn't going to be left alone for long periods of time. Also great that you're thinking about things like separation anxiety ahead. One of the most common behavioural problems that we're seeing in dogs, especially since the pandemic. I think this is all about balance for me. Even if you are working from home, you do still need to give your dog periods of time where they are left alone, that they have some chill time, even going out, from the house without them for periods of time, even from when you first get them, I think is really important. Doesn't say whether you're thinking of getting a dog or a puppy, but it's important to put these sort of routines and this structure in place from the start, I would say. Annie, anything else?
I think the only thing to mention really is obviously when you're looking at getting a dog, whether it's a rescue or a puppy, is just making sure that that's a dog that fits your lifestyle. I mean, you haven't said how active you are outside of, working from home and things like that, and what sort of area you live in. But, we do think it's a really good idea that you kind of do a lot of research into the different breeds and to understand the kind of energy levels they'll have from the offset, really. So I think, yeah, just have a real good look at all the breeds out there and work out sort of what would work for you and your lifestyle, as well as obviously you're working from home and your working environment.
Yeah, really good advice there about picking the right sort of breed based on lifestyle rather than aesthetics. It's the biggest problem. People go out and get dogs because of the way they look, not actually considering what they've been bred for, and not having the dog in the right circumstances with the right activity levels, with the right mental sort of stimulation can lead to issues. One thing I would say on this is that I do have a lot of days where I'm working from home as well. Really important to put structure into your diary. It sounds silly, but people that I often find working from home, sort of meetings run over. You don't really have that sort of real structure with a dog. Make sure you have, give them a routine before you start work. You've got a routine in the middle of the day where you're taking a break. It's good for you as well to take a break out of work as well, and a routine at the end, and try and keep that the same as where you might be, working in the office for the day, so that those routines are sort of maintained. I think that's really, really helpful.
Definitely agree with that. Good luck on your search and for being a first time dog guardian.
Send pictures.
Yeah.
Send pictures. We love pictures of new dogs.
Right. So this last question, I'm afraid I'm not going to be able to help you answer at all. Recognise the name here. Mr. London 84 has asked, does my husband love Rodney more than me? I'll let you over to you for that one.
I don't feel like I should answer this one.
Oh, you mean it's not an easy one?
Oh gosh, this could cause quite a bit of trouble at home, couldn't it?
It could.
I don't know why that question's even been asked. Is you see this a lot, don't you? Though on social media, don't you? About it's me or the dog, or
Mm.
and the sort of implications of having a pet. But listen, okay, pets often love us unconditionally, don't they?
Absolutely.
So I think it's a different kind of love, isn't it? But I do think that where you're ultimately more responsible for that being, you do have a different kind of love for him. Be very diplomatic in my answer
You
here,
are
isn't
very, very political. I have a good spin on this though, and what I want to know is, does Rodney love you more than Mr. London 84, or Mr. London 84 more than you? That is my
Well, it's really interesting, isn't it, that? Because I don't always feel that Rodney's reciprocates the care and attention we give him. Like, I mean, he chooses who he favours, at any one particular time. So,
yeah.
for example, last night he just completely ignored me, but he was all over Chris. And often, sometimes when you open the door, he'll run straight past Chris and come straight to me. So he really does pick and choose. And I don't know if children sort of do this as well with their
Yeah.
favourite parent. I'm sure they do. But you never really know on any given day who Rodney's really sort of
Favourite.
favouring, which is interesting, isn't it? I'm not actually a needy person, so it doesn't bother me at all. I can be, quite objective about it and just think, well, in a week's time, he'll probably like me again. But it really goes down to who he wants to greet, whose knee he wants to sit on,
Yeah.
who he wants to go for a walk with. He definitely favours, but he's a little independent terrier, and I wouldn't have him any other way.
No.
But I would say, in answer to this question, in a very diplomatic way, I think it's a very different love that I have for my dog versus my husband.
Very well saved, I reckon.
I'd say so. When you choose to get married, you're putting yourself forward for a lifetime of commitment, aren't you? But dogs are only with us for too short a time, I would say. So you've got to give them as much love as you can while they're here. How's that for a diplomatic answer?
Very good. Very good. I'd buy it any day.
I wonder if you just asked the average sort of pet guardian that answer, do you love your pet, or do you love your husband, or the other way around? It's a really interesting one, isn't it? Because there are a lot of people out there getting themselves into trouble by their answers.
You're right though to say what you said. I think it's a very different kind of love. I don't think you can equate it. It's not about who you love more. It's just a very different kind of bond. There you go.
That's my answer, and I'm sticking with it.
Yeah, there you go, Mr. London 84. Ever the politician.
Yeah. So thank you so much to everyone who sent in the questions. We've really enjoyed answering them today. Annie, I think we should do this again, don't you?
Yep, totally agree. Lots of really different questions there, which is great to see.
Well, there you go. We'll make this a regular feature. So if you like your question to be answered on a future episode, then make sure you're following me at Dr. Paul the Vet, because that's where we'll be asking for them. And of course, if we've answered your question today, keep an eye on our posts when the episode goes live, and we'll be tagging you in them so you can share them too. Thank you for listening to this episode. You'll find all the relevant links to this conversation in the show notes. If you enjoyed it, please follow us and leave a review. It really helps other people discover the podcast. For more insights on topics like this, you can connect with me on social media at Dr. Paul the Vet, or check out my website, theconsultroom.co.uk.